Hello to all the viewers and welcome back to my channel MedPharmaco Essentials. So today's video it is mainly about a case study that will help us to know what is the choice of diuretics in many of the patients. So let's move on to the case. Here is the case of 65-year-old male patient who came to the emergency department with severe shortness of breath. So his wife reports that he had known that he was hypertensive long back, but he did not had any of the symptoms, so he refused to take the antihypertensive medications. But during the last month, he noticed that there was increased in the ankle edema, reduced exercise tolerance, difficulty sleeping when lying down. But he reports no episodes of chest pain or discomfort. Now he has pitting edema in the knees and is actually uncomfortable while lying down. So vital signs include blood pressure was 190, 140 mmHg and the pulse was 120 bpm. Respiratory rate was noted to be 20 per minute. So chest auscultation revealed that he had bronchi, but an electrocardiogram is negative for the evidence of left ventricular hypertrophy. He is given with a diuretic intravenously and it's admitted to the intensive care unit. So what diuretic will be appropriate for the man with acute pulmonary edema associated with the heart failure? And what are the possible toxicities during this therapy? So first of all, we know that diuretics are the agents, they are the antihypertensives which will prevent the retention of the sodium and water. So when there is preventing of this retention, what happens? They will eliminate that sodium and water in the urine. So the kidney will eliminate. Now decrease in the sodium and water levels in the blood will decrease the blood volume automatically. So when there is decrease in the blood volume, there is decrease in the preload. Preload is nothing but the amount of blood that is entering into your right heart. So that will be decreased and hence there is decrease in stroke volume, cardiac output and hence the blood pressure will be decreased. The main indication of this diuretics is in case of congestive heart failure and volume overload patients. We suggest this. Now you have to know which is the preferred one. There are two types of diuretics we know, right? Thiazide diuretics and loop diuretics. Basically, we know that thiazide diuretics, what they do, they will block the reabsorption of sodium and water in the distal convoluted tubule. Examples is chlorothiazide, chlorthalidone, metalazone. So all these are thiazide diuretics. And these are first line agents actually for the hypertensive patients. Now, this loop diuretics, they will inhibit the sodium potassium chlorine symporter in the case of thick ascending loop of Henle. So when they inhibit that, there is inhibition of sodium chloride as well as potassium reabsorption. The blood volume will automatically decrease, preload will decrease, stroke volume and cardiac output will decrease and hence the blood pressure will decrease. So now this is mainly indicated for congestive heart failure. You should know that loop diuretics is mainly preferred. And the drugs under this, mainly the famous one that includes is furosemide, torsemide. So all those things will be included. So after knowing all those concepts, now let us move on back to the case. So the diuretic mainly preferred here for the congestive heart failure is the loop diuretic, like the furosemide. You can give it IV in the dosage of 40 mg. If necessary, you can continue with an oral administration of 20 to 40 mg per 24 hours. Now the adverse effect is most commonly connected with its mechanism of action, because it will decrease the amount of sodium potassium proton will be pulled out in the urine. So when that happens, what are the conditions that the patient can face? That is hyponatremia, that is decrease in the sodium levels, then hypokalemia, decrease in the potassium levels, increase in the protons can lead to metabolic acidosis in the patient. Along with these mechanisms, uric acid excretion in the proximal convoluted tubule is also inhibited. So due to this, what happens? The uric acid level will increase and you should be careful in the patients who have gout condition. Okay, so the patient might also get hypomagnesemia and as well as the allergic reactions can also be seen in the patient. So this was all about the diuretic agents and a brief information about the diuretics and its adverse effects with the case study. Thanks for watching the video.